program is one that employs evidence-based intervention, such as applied behavior analysis. A good ABA program should have the objectives that teach the child as a whole, so that your child can acquire the skills that will facilitate his or her development and help them achieve the greatest degree of independence and highest quality of life possible. While all ABA may be founded on the same behavioral principles, not all ABA is alike. There is presently tremendous variation in the teaching approach, ranging from those that are rigid, following a fixed protocol, regardless of the profile of the child. And then on the other end, there's a teaching approach that might be extremely lackadaisical, unstructured, without much of a clear path to achieving important goals and outcomes. So it is important to find an ABA approach that is balanced and falls somewhere in between. On top of that, it is imperative that the skill of those who are implementing the therapy are critical thinkers who are highly trained with precise technical skills coupled with naturalistic teaching styles. There are several research studies demonstrating the effectiveness of ABA for children diagnosed with autism. In these studies, the children with the best possible outcomes had these key elements in common in their ABA program. Starting early. The younger the child, the better. Getting intensive supervision, because this helps move goals along quicker and also helps troubleshoot problems that may occur in the child's learning journey. Parental involvement, because when parents are involved, this helps to accelerate that generalization process. Having intensive hours, because we have to make sure that there's enough time to teach all the different goals that the child needs to learn. Consistency of treatment. It is important that although you might be doing intensive number of therapy hours, it's better not to have a mix of different types of treatment, because that can be confusing for the child and also dilutes the impact of the ABA. And finally, making sure you have a quality ABA program. So your question might be, what makes a good quality ABA program? The Autism Partnership Method is based on nearly 50 years of clinical and research experience. Our unique approach to ABA shows that the most effective option is to have a careful balance of structured flexibility while still retaining the essence of a systematic, empirical approach to teaching that is individually tailored for each child. With a child-friendly and comprehensive approach, the APM is a progressive form of ABA that focuses on in-the-moment analysis and clinical judgment, rather than following a fixed protocol, as we know that each child is different, so therefore cannot be taught in the exact same way. This is also why we put such a huge emphasis on supervision and training of our therapists, because we believe the more skilled our therapists become, the bigger the impact on the progress of each child.